If your dermatologist suggested Mohs surgery for a skin cancer, here is what it actually involves. Mohs is a precise tissue-sparing way to remove skin cancer by taking out thin layers, one at a time. Each layer is checked under a microscope right away. Removal only stops when no cancer cells remain at the edges. Doctors commonly use Mohs for cancers on the face, ears, scalp, hands, and other areas where preserving skin matters. It is often chosen for tumors with unclear borders, aggressive types, or cancers that returned after earlier treatment. The procedure happens in clinic under local anaesthetic. You stay awake, and the area is fully numbed. The surgeon removes the visible tumor with a thin rim of skin, then processes it in an on-site lab. Processing takes about an hour. If any edges still show cancer, another thin layer is removed from just those spots. Once the edges are clear, the wound is closed with stitches, a skin flap, a graft, or allowed to heal naturally. Most cancers are cleared in 1 or 2 stages. The whole day usually takes 4 to 8 hours at the clinic. Healing takes about 2 weeks. Swelling peaks around day 2 or 3, and stitches come out within 5 to 14 days. Studies show cure rates of around 97 to 99% for common basal cell cancers, with regular follow-up recommended. After Mohs, regular skin checks and sun protection help catch any new spots early and keep the skin healthy long-term. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.